Welcome to your week-by-week pregnancy video series, brought to you by Ultrasound Dimensions, Medical and Maternity Ultrasound Centre.
Welcome to PregnancyChat.com and week 35, month 8 of your pregnancy. I'm Monica Healy. Let's start off by talking about what is happening with baby this week. If you can imagine all curled up, your baby is the size of this turnip this week. Your baby is just over 18 inches, 45.7 centimeters this week, and weighs about 5.5 pounds, 2.5 kilograms. Baby is almost ready to enter the world. If baby were born today, he or she would have a very good chance of survival. Baby's lungs, if not already fully mature, are quite close to being complete. As baby breathes, she produces surfactant, a protein that lowers surface tension in the lungs and is essential for her little lungs' healthy development. Baby's kidneys are also fully developed, and her tiny but efficient liver is able to process small portions of waste. Baby's central nervous system, brain, and digestive tract continue to strengthen as well. Although she will not grow much longer before birth, baby will continue to gain weight, about a half a pound or a quarter kilo a week, as she accumulates fat beneath the skin, around the muscles, and surrounding the abdomen. She's gotten to a size that makes it more difficult for her to execute large movements. You should feel about the same amount of activity, but you will sense decreased full body movement, such as flips and twists. Although baby's basic physical characteristics are completely developed, baby still needs to finalize a few important skills, such as sucking, before entering the world. She's been practicing on anything that comes in contact with her mouth: thumbs, fingers, maybe even a toe or two. Anything vaguely nipple-like that comes close to her mouth triggers an instinctual sucking reflex that appears as early as 11 weeks. Okay, now let's see what's happening with you this week. Your uterus is an incredible 1,000 times larger than it was before you conceived, stretching to just under your rib cage. It's no wonder, since your baby has transformed from a petite poppy seed to a colossal turnip. Even your blood volume is heavier, increasing by 50% in the first 2 trimesters. Your blood volume will remain the same from here on out and decrease back to normal levels after you give birth. By now, most babies have turned into the head down position, squashing your organs and particularly your urinary bladder. This would explain all those bathroom breaks as of late. And if you sprung a leak, a urine leak that is, you are among many women who lose a bit of urine during a sneeze, a cough, or a bout of laughter. Strengthen your pelvic muscles by contracting the pelvic floor, known as Kegel exercises. We've described these before. Kegels will benefit you postpartum as well, helping your body recover from birth. You are only going to feel heavier from this point on as your belly continues to expand. If cramped quarters in your midsection are making you eat full meals uncomfortable, try to eat smaller but frequent meals instead. The added weight may also cause swollen feet and ankles, so keep those feet elevated when possible, and do not sit or stand in one position for extended periods of time. If you're a frequent car traveler, take breaks from the road and walk around for several minutes every 2 to 3 hours. Perhaps the added weight, aches and pains and cramped abdomen are weighing you down, literally. But remember, there are only 2 more weeks before you are officially considered full term. And while many women do not go into labor until 40 weeks or beyond, you're almost there. Your body is getting ready by stepping up the Braxton Hicks contractions. This is perfectly normal. However, if you have more than 5 contractions in an hour that last for a minute or longer, or your water breaks, or you begin leaking, go to the hospital immediately. You've probably begun to see your doctor more frequently now, and around this stage of pregnancy is when your practitioner will perform a Group B streptococcus test, which consists of a culture with a cotton swab from both the vagina and the rectum. The bacteria is harmless in adults, but can be extremely dangerous if it is passed on to the baby during birth, possibly causing pneumonia, meningitis, or even a blood infection. The bacteria comes and goes, and approximately 10 to 30% of women will test positive. But you'll be given an IV bag of antibiotics during labor and delivery if you do test positive. Here are my tips for week 35. It is a good idea to begin preparing for your maternity leave if you have not already done so. Be sure to research the rules of your workplace as well as the provisions that the state or country provide. You should consider attending an antenatal class if you have not looked into it already. Begin to familiarize yourself with the benefits and process of breastfeeding as well as formula feeding. If you decide to breastfeed, consult your doctor on ways to prepare your body. Some practitioners have suggested rubbing the nipples with a coarse washcloth to toughen them up a little. If you choose to breastfeed, you will want to look into finding a comfortable and practical nursing bra. Keep in mind that your breasts will likely become even larger when the milk begins to come in. Look into disposable and reusable diapers or nappies and stock up on the ones that seem to fit your lifestyle best. It may be a great time to treat yourself to a pedicure. It will help relax you, and it may be the last thing you're able to do for yourself for some time. So that's it for week 35. If you have any questions or comments, please join in the conversations in the forums at pregnancychat.com. I can't wait to tell you what is happening during week 36. Until then, enjoy this pregnancy journey. These are the precious moments our lives are made of. I'm Monica Healy, and thanks for watching.
Thank you for watching. If you're looking for a medical or maternity ultrasound scan, we can help. Since 2007, Ultrasound Dimensions has been trusted by over 31,000 patients and doctors. Our Enterprise Ireland award-winning team offers you convenient appointments, immediate results, and always takes the time to give you peace of mind. To schedule your appointment, contact us today.